But he was
Hold on one
like,
second. Some experiences that I had with training of newer physicians, we used to think that the computer was the problem. So we used to train them for 2 weeks on the computer. I'm starting to see that the computer is really not the problem anymore. So what we're doing is we're teaching them the computer pretty quickly, like in a day or two. And then we're letting them run the show in the room and we're just not saying anything and letting them talk. So they're learning our ways. I'm also finding a little bit like if I find interesting cases in the room, I try to bring them in to see it. Some of them say to me, do you think I don't know that? Do you think I've never seen that? They look at it as you're watching them. Dr. Riley, my associate, my partner at the office, he looks at the charts. They feel like they're being bullied. Somebody's watching them. Why are they looking at their charts? So there's a little bit of it's a dance that you got to do without upsetting somebody.
Yeah.
I don't know. So first of all, George's experience at RBK was pretty interesting when he got there about 80 years ago.
Oh, stop it.
The senior
Not more than
partner,
50 years.
not more,
Not
but
more
about
than
the senior partner just took a chart, handed to him.
50. Yeah. Right.
Here, go see the patient.
Right. Yeah.
Welcome.
Yeah. Yeah.
You remember that?
Welcome to RBK Pediatric. Oh, it was
Yeah.
called Reichman, Brown, and Kaplan Pediatric because you had to have the marquee. Welcome. Room number 12. You have your first patient. Good luck. That was training.
Yeah. I also think a lot of the owners are a bit burnt out when they bring on people. So they're just so happy to have some relief. And
I don't think Dr. Reichman knew what the word burnt out means.
But I don't know. Maybe it's my age, but since I'm always moving from practice to practice, is what I do nowadays. But when the owner comes back, I sit down with them with all the difficult cases that they need to follow up, because I may handle them one way, you might handle them another one, George might handle another way.
Yeah.
But they need follow up.
Mm-hmm.
And the electronic medical record is not great at conveying exactly what I'm thinking.
Mm-hmm. Mm-hmm.
And so if it's a complex patient or maybe a problem patient, I want to make sure the practice owner is aware of it,
Mm-hmm.
so that they know what to do when they see him that.
Yeah.
I would hope that you would write that in your progress notes. I'm looking at it from the point of view where we get a lot of patients a year. Do you really think I'm going to run around with a little piece of paper of the notes that I took from your discussion with me to follow up this patient? You should book an appointment. You should write a good progress note, and your progress note should convey your message to me.
Well, you have a very large practice, so it is a little different.
Yeah, I know.
Than 1 to 3 person practice. And even though you try to convey the message on the note, sometimes it's just not understandable. Like, I called Child Protective Services on a 17-and-a-half-year-old.
Okay.
And I documented that I called, left a note,
Mm-hmm.
the report number. And when I told Dr. Sinha why I did that, it was like, here's why I did that. This is a 17-and-a-half-year-old that's lost 25 pounds in the last 2 years, is down to 90 pounds. The first time I saw her in your clinic, her heart rate was mid-50s. Sodium, potassium, everything else is normal. I put her on Lexapro, and I asked her mom to go see the eating disorders clinic at Children's National. She came back, saw you. She hadn't made the appointment. You had them follow up with the day that I was covering your practice. I again talked to the mother. She stopped the Lexapro, and the kid gained a pound, and she said she's all better. And the mom doesn't leave the exam room when you're trying to talk to this child. And I said, I want to see you back in a month for a weight check. And by then I need to see an appointment with with Children's. And she said, is it really necessary? I said, I'm telling you, I want to see the appointment. And she canceled the appointment, and it was a no-show. So that was the last. I don't threaten, but that was the last straw.
Mm-hmm.
But I can't really convey all of that on a progress note in the middle of ECW. It's impossible.
Right.
But she looked at me, she says, oh yeah, I know who this is. The mom's really tall. I'm worried about that kid. What are we going to do? I said, we know you're going to get the call, and she's going to be angry, because that's what's going to happen. the manager knows when she calls back and she screams and says, I'm a horrible person with 3 horns.
Yeah.
You're going to go, oh yeah, I know you are.